Hello, everyone. It's Dr. Kerry Yerkew here. I'm a chiropractor in Kelowna, and today I'm answering questions from my last podcast called Numb Hands, Tingling Feet. And this is in preparation for a webinar coming up in September where I'll be talking about numb hands and tingling feet. And I'm writing an accompanying booklet, about 50 pages, that'll get published on Amazon that'll go with the webinar. I should have that ready by next weekend. So we'll have that booklet in advance of the webinar, at least the electronic copy on Amazon, the ebook, the Kindle version. So here's some questions from the audience over the last week. Question one is, when should someone actually worry about numbness? How do you know if it's serious? So when should someone worry about numbness? I think if you have numbness that is causing you to lose function. You can't do your job. You cannot drive a car. It's hard to walk. You've got other symptoms accompanying this. I think that's getting pretty serious, and I think it's important to go see a healthcare provider as soon as possible to deal with that. Sometimes people put it off, which I'll talk about in this podcast, but sometimes people put it off and they think it'll go away, but it's not. Or sometimes people will mask it with medications, but it's still not dealing with the cause of the problem. So very important that if it is affecting your quality of life, that you do something about the numbness. Question two is, I've tried a wrist brace and it helped a little, but not completely. Does that mean I have carpal tunnel? Not necessarily. Wrist braces do help with sprains and strains of the wrist, like repetitive sprain or strain. Let's say you're a cashier at a store. I was just at Costco yesterday, scanning a lot of items. That can cause strain or sprain of the ligaments in the wrist for sure. Now, sometimes that can develop into carpal tunnel. There's a nerve running through the carpal tunnel in the wrist, which is like an anatomical structure. And so if that nerve's getting pinched by the bones and or inflammation in that area, that can cause numbness and tingling in the hand and weakness. Sometimes if it's there for a long time, it can even cause atrophy or weakness of the muscles in the palm. So now, if you try a wrist brace and it doesn't completely help, does that mean you have carpal tunnel? No, because we have to find out exactly where the cause of the problem is, where the pressure is, release that pressure so the nerve flow can be restored. Then we have to prevent that from coming back again. So dealing with the repetitive strain, strengthening the wrist once we have proper alignment of the bones in the wrist. And there's many bones in the wrist. There's 8 bones in the wrist. So we have to have good alignment of those bones. We have to have proper function, flexibility of that joint. And then we need the strengthening so that you can handle that repetitive strain, let's say, or if you have heavy lifting or whatever you're doing to prevent that carpal tunnel. Now, I've even seen people with numbness in their hand and it's coming from their neck. So they're getting a pinched nerve up here in the neck, traveling down their arm to their hand, and they think it's carpal tunnel, but it's coming from an area like way up the line. So it's important that you have that checked. Chiropractor is really good at that. We are accepting new patients in Kelowna if you want to come and see us. And all you have to do is click on the link in the bio or in the show notes below to get to book an appointment. Also, you can go to those links to get a ticket for this webinar coming up if you want to learn more about what you can do for yourself. Question number 3, I've had numb feet for a few years now. I just figured it was part of aging. Should I be concerned? Numb feet is not necessarily part of aging. As we age, the fat pads in our feet, they do reduce. So we have less cushion, but that doesn't mean you'll have numbness or nerves that are getting compressed. So sometimes that can be a result of pressure on the nerves right in the feet. Sometimes there can be pinch nerves like in the spine and the sciatic nerve going down your leg from the lower part of your back. Um, Sometimes there can be vitamin deficiencies, side effects of medications. There can be pinched nerve in your knee. There can be strain of tissues in the feet, even like the plantar fascia, like plantar fasciitis, which is strain of the arch, like flat feet or pronation of the foot. So there's a lot of different reasons for numbness, but we definitely want to find out what's causing it and deal with that and help the neuropathy that's there in the foot. So finding out the cause, doing the right treatment for it, and then preventing a reoccurrence is the goal. Number 4 is, what's the biggest mistake you see people make when they have numbness? I think trying to self-medicate or trying to get a device that's going to help with that, even a salve. I think it's natural to want to help yourself and do something, but sometimes people continue to leave the device on. They continue to use those salves or the medication when it's not working or it's only minimally working, and they continue to have the numbness. I think just taking too long to get help, and help is, pretty easy. You can book an appointment in a few days at our clinic. Very easy to get an appointment. We'll do a consultation. We will then do a examination. We'll tell you what the problem is. We'll get some diagnostic testing if we need to. And then we're going to do the treatment to help you with the numbness, and it can be very effective. I had a lady this week, she had numbness in both legs because she hurt her back, and she previously had a disc issue years ago, but had managed it quite well. But she kind of got off track. She was on vacation. She wasn't doing her normal routine, sleeping in a different bed. She was cleaning her house and was doing a lot of repetitive bending and twisting, and that caused this problem to come back again. So again, pinched nerves in the low back, the sciatic, numbness in both legs going down to the feet. And what we were able to do is diagnose that properly, do the adjustments, get laser therapy to heal the soft tissues, and that made a huge difference. So she could go back home and be in a lot less pain. Question 6, how do I know if my numbness is mechanical or coming from something inside my body? That's a good question, and I think mechanical pain, it changes with when your position changes. So if you're moving or sitting a certain way or standing and that pain comes back or it increases, that's mechanical pain. If it's something else, if there's no routine to it, if there's no kind of cycle to it, if it's there all the time, that may be something more systemic. And question 7, have I had this for years? I've had this for years and nothing's worked. Is it just something I have to live with? I think too many people think they have to live with their pain and discomfort. There's always someone who can help or may have a different technique or different system of care. They may find something that wasn't found before. So I would continue to seek out answers and get help. I don't just learn how to live with it, because a lot of times symptoms and conditions can be improved on. So don't kind of get complacent with that. Really continue to pursue answers for your condition. Again, I want to thank you guys for joining me for this podcast today. We do have the webinar coming up in September. So to get a ticket for that, click on the link in the bio or the description below. After the webinar, you can get a VIP ticket, and I'll be answering some questions from the audience at the meet and greet after the webinar. You can also join our mastermind group where we'll be talking about numb hands and tingling feet on a monthly basis. We do have some one-on-one consultations in the clinic, and if you're not in our area, online. So those options are available to you as well. And then the booklet that goes with the webinar, it's going to be on Amazon. Again, use those links to get the booklet, and I hope to see you guys soon.